Hi, and welcome back to the Rosie the Riveting channel. Today we're going to be going over some practice questions as well as prioritization questions. These do tend to trip a lot of students up, so let's break it down one by one and let's take these questions together. So let's start with the first one, and this is the chapter. The book that we are using is the Prioritization and Delegation and Assessment. This is known as the Charity textbook. My students use this. So this is for educational purposes. So just keep that in mind. Let's get this lined up again. Okay, so first question. When scheduling a patient for skin testing for allergies, which information is most important for the allergy clinic nurse to include in patient teaching? 1. Avoid taking antihistamines or antihistamine containing medications for 5 to 7 days before skin testing. 2. You may need to wear a patch for 48 hours in case of a delayed reaction. 3. Swelling and itching may occur at the site of the skin testing. Or 4, patient will need to wait in the clinic for 20 minutes after testing. The correct answer, it's going to be number 1. The reason why is because the patient's coming in for allergy testing. If they're taking antihistamine medications already, the test is going to be invalid. So in order for the test to actually work and be successful, we're going to have you hold off on taking any of your antihistamines. So let's go to the next one. Which finding will be most important for the nurse to report to the healthcare provider about a patient who is taking prednisone chronically after an organ transplant? 1. Multiple arm bruises. 2. Sodium level 146. 3. Blood glucose of 110. Or 4. Black colored stools. And the correct answer for this one, that is going to be the black colored stools. That can be a sign of a GI bleed. For the sodium levels, usually sodium levels are between 135 to 146, being one little deciliter off, and that's not going to be the biggest concern for us. We do know that steroids do increase your glucose, so 110, not that bad, kind of an expected finding. And arm bruises, that can definitely happen. But the number one thing, the most important thing, the key word, most important, is going to be those black colored stools. So let's move on to number 3. When the occupational health nurse is teaching assistive personnel about blood-borne pathogen exposure and human immunodeficiency virus (HIV) risk, which information is most important to emphasize? 1. Occupational transmission of HIV from patients to healthcare workers is relatively rare. 2. Occupational exposure to HIV containing fluids should be reported immediately to the supervisor. 3. Treatment for occupational exposure to HIV may include use of antiretroviral medications. Or 4. Post-exposure treatment will include HIV testing at baseline and at several intervals after exposure. The correct answer is going to be number 1. So occupational transmission of HIV from patients to healthcare workers, it is relatively rare. It doesn't happen very commonly. It is good to know that the patient's still going to be standard precaution. There's not going to be any special precautions for patients with HIV at all. So it's just standard precautions. So let's move on to number 4. A patient in the allergy clinic who has a rash has received Benadryl 50 milligrams PO. Which patient information is most indicative of the need for action by the nurse? 1. The patient is preparing to drive home. 2. The patient reports itching at the site of the rash. 3. The patient has a history of constipation. And 4. The patient states, "My mouth feels so dry." The correct answer is going to be number 1. The reason why is because Benadryl does make patients pretty drowsy, so it is absolutely unsafe. Goes against patient safety, and they can actually harm other people. So that's where we would really step in. 5. After a change of shift report, which newly admitted patient should the nurse see first? 1. A patient with human immunodeficiency virus whose CD4 count is 45. 2. A patient with acute kidney transplant rejection who has a scheduled dose of prednisone. 3. A patient with graft versus host disease who has frequent liquid stools. Or 4. A patient with hypertension who has an angioedema after receiving lisinopril. If you picked number 4, that is the correct one. The reason why is because this is a sign of an allergic reaction to that lisinopril. And that is something that we need to act on very fast for these patients, especially if they have angioedema that can eventually cause airway obstruction. Number 6, a few minutes after the nurse has given an intradermal injection of an allergen to a patient who's undergoing skin testing for allergies, the patient reports feeling anxious, short of breath, and dizzy. Which action included in the emergency protocol would the nurse take first? 1. Start oxygen 6 liters per minute using a face mask. 2. Obtain IV access with a large bore IV catheter. 3. Give epinephrine 0.5 milligrams intramuscularly. Or 4. Administer albuterol per nebulizer mask. The correct question, that's going to be epinephrine. The reason why, the patient is showing signs of an allergic reaction. We need to reverse it. And so what we need to do, we need to give them that epi. If they're low in oxygen, of course we're going to give them oxygen too. But your priority, the first thing that you should do is get that epi. That's going to be working fast to help alleviate those very risky allergic reaction signs and symptoms. Okay. So the nurse manager in a public health department is implementing a plan to reduce the incidence of infection with human immunodeficiency virus in the community. Which nursing action will be delegated to assisted personnel working for the agency? Number 1. Supplying injection drug users with sterile injection equipment such as needles and syringes. 2. Interviewing patients about behaviors that indicate a need for annual HIV testing. 3. Teaching high-risk community members about the use of condoms in preventing HIV infection. Or 4. Assessing the community to determine which population group to target for education. The correct answer is going to be number 1. Now, the reason why it's number 1 is because the other 3 options, that is going to be the nurse's scope of practice, not an AP, and an AP is a CNA. An AP can supply sterile equipment to the patients. So let's move on to number 8. Oops, let's get this focused. There we go. The nurse is supervising a student nurse who is caring for a patient with human immunodeficiency HIV. The patient has severe esophagitis caused by Candida albicans. I can never say this right. Basically, it's thrush. Which action by the student requires the most rapid intervention by the nurse? So when you have these questions, you're looking for what is the student doing that is not correct. That's going to be the correct answer. So, putting on a mask and gown before entering the patient's room, giving the patient a glass of water after administering the prescribed oral nystatin suspension, suggesting that the patient should order chili con carne or chicken soup for the next meal. Or 4, placing no visitors sign on the door of the patient's room. The correct answer is giving the patient a glass of water after administering prescribed nystatin suspension. Now, the reason why, and remember, a suspension, that is those cups that you get from the Pyxis, and it's a syrup. It's an oral medication that needs to stay and coat and work on that fungal infection to help treat it. So if we have water right afterwards, it's going to wash away that nystatin. Now the other ones, yes, those are actually incorrect. We don't want to necessarily put no visitors on the room. That can be an intrusion of privacy for the patient. If they don't want visitors, they can just tell us. And then we don't need to really put signs on the room. Putting on a mask and gown before entering the patient's room. The reason why that one is not the most rapid intervention is because it's not detrimental. Do you need a mask and gown before entering an HIV patient's room? No, it's standard precautions. However, the rapid intervention that needs to happen is giving that glass of water because we need that oral nystatin to work to help the patient with their thrush. Now, what makes the third option incorrect is the fact that it's chili con carne. That is pretty spicy, and usually these patients they can't handle spicy food, so that would not be a good idea. So that's why the answer number 2 is the most important. The nurse is evaluating a patient with human immunodeficiency virus who is receiving your trimethoprim sulfonamaxol as a treatment for pneumocystis jirovecii pneumonia. Which information is most important to communicate to the healthcare provider? 1. The patient reports a blistering rash. 2. The patient's fluid intake is 2 liters a day. 3. The patient's potassium is 3.4. 4. The patient enjoys spending time outside in the sun. Now, what's going to be the most important is number 1. The patient reports a blistering rash. So the reason why this is the most important one and the most correct answer is because this can be a sign of Stevens-Johnson's syndrome. Now, having 2 liters of fluid a day, that's pretty good. That's nothing to be worried about. Potassium level 3.4. Usually your potassium is 3.5. Is usually like the lower end of it. So it's just 1 like deciliter off, or a tenth off, I should say. So that's not necessarily a big deal. Are we going to let the provider know, hey, maybe their potassium is starting to drop? Yes, but it's not something that we're going to act on right now. And then the patient can still go outside but be responsible with their sun care. The reason why is because this particular antibiotic, this can make your skin more susceptible to sunburns. So we're going to educate them on staying out of the sun when the UV rays are the highest between like 11 and 3 in the afternoon. Use SPF. Don't just sit in the sun all day, just a few minutes and then you get out. And also just meticulous skin protection. But the most important thing that we are going to report to the provider is a Stevens-Johnson's reaction. So that's going to be number 1. So 10. A nursing student is helping the precepting nurse work through a pre-operative checklist for a patient with rheumatoid arthritis who is scheduled to have an arthrodesis, The student asks the nurse what an arthrodesis is so she can explain to the procedure and the risk to the patient before having the permit signed. What is the best response by the nurse? One, a student nurse is not allowed to teach a patient without a preceptor present. We can do it together. Two, the surgery involves removing the affected joint and fusing the adjacent joints together. Three, don't worry about it. The surgeon will explain the procedure and all the potential risks. And four, we'll discuss arthrodesis, but the surgeon will explain the procedure and risk. We witness the patient's signature. Now, the most appropriate answer is going to be number four. The reason why, because we don't do the education about the risks and the benefits of any type of surgery. That is going to have to come from an actual surgeon, the surgeon that's going to be doing this. We can definitely be a witness, but we're not the ones that are explaining the risks and benefits to the patient. That has to come from the doctor. Now we can reinforce already taught information that the surgeon has taught the patient, but if they still have a lot of questions, a lot of doubts about the surgeries, we're going to get the surgeon back into the room and have them talk about the surgery again. So, 11, a patient with newly diagnosed acquired immunodeficiency syndrome, also known as AIDS, has 6 millimeter indurations at 48 hours after a skin test for tuberculosis. Which action will the nurse anticipate taking next? 1. Arrange for a chest x-ray to check for active TB. 2. Tell the patient that the TB test results are negative. 3. Teach the patient about multi-drug treatment for TB. Or 4. Schedule TB testing again in 12 months. The most appropriate answer, that is going to be number 1. If they have a positive test, and that's definitely a positive test based off of the data provided in the question, we need to make sure whether or not this is an active TB or maybe they had been exposed. Remember, a positive skin TB test doesn't necessarily mean the patient actually has active TB. This can be they either had the vaccine if they're from a different country, or this means that they were exposed, or they means that they really do have it. The other reason why number 4 is wrong is because we actually need to figure out, is this an active infection, and if it is, we have to get this patient started on medications ASAP, because this can be a pretty aggressive infection, especially in a patient who is severely immunocompromised, such as an AIDS patient. We are not going to be teaching the patient about multi-drug treatments. The provider needs to go over treatment options with the patient and then tell the patient that the TB test results are negative. No, we're not going to tell them that because that's lying to the patient, and that's not fair to the patient. That's pretty unethical. So, number 12, the nurse is working in a hospice facility for patients with acquired immunodeficiency syndrome. The facility is staffed with LPNs, LVNs, and assisted personnel. Which action will the nurse assign to the LPN, LVN? 1. Assessing patients' nutritional needs and individualizing diet plans to improve nutrition. 2. Collecting data about the patient's responses to medications used for pain and anorexia. 3. Developing AP training programs about how to lower the risk of spreading infections. 4. Assisting patients with personal hygiene and other activities of daily living as needed. The correct answer, that is going to be number 2. Now, APs and LPNs, they collect data, they do not assess. That term assess in number 1 You can toss that option out. The reason why is because nurses assess, LPNs and APs do not. They collect data. Now, we can number 3 is incorrect because developing AP training programs, that is also the RN scope of practice. Assisting patients with personal hygiene and other activities. This may have been something that you did choose as an option because they definitely can do this. Now, the reason that separates this from number 2 is because an AP can do that. So if an AP is also an option in the question that's being asked, an AP can always do personal hygiene and vitals like that, but collecting data, that can be an LPN. So that's why that is the most appropriate. So number 13, a patient who has received a kidney transplant has been admitted to the medical unit with acute rejection and is receiving IV cyclosporine and prednisolone. Which staff member is best to assign to care for this patient? Number 1, RN who floated from the medical unit to the medical unit from the coronary care unit for the day. 2, RN with 3 years experience in the operating room who is orienting to the medical unit. 3, RN who has worked in the medical unit for 5 years and is working a double shift today. 4, newly graduated RN who needs experience with IV medication administration. The correct answer, that's going to be number 3. Now, when you have these questions, and so this is a patient, basically, you want to take a step back and look at it. This patient is very complex. This needs to go to the very experienced nurse who this is their home unit. You're not going to give this to a nurse who is new to the unit and orienting, whether or not they are a new grad or they are a nurse in previous other areas. Either way, they're still a new nurse to the unit. They're still being taught. The reason why number 1 is inappropriate is because they're afloat. They should not be taking your core patients. They should be taking your less core patients. And what that really means is, so for example, I worked in bone marrow transplant, right? And let's say we had a nurse from GI float to our unit. We are not going to give her one of our BMT patients. We're going to give her one of our med surg patients who's overflow because they can't go anywhere else. And we would also give her any other patient that mimics or looks very familiar to her according to what her home unit is. Like if we have a GI bleed patient, we can definitely give that to a nurse who's floating from the GI unit. So hopefully that makes a little bit of sense. So in these questions, it needs to go to the most experienced nurse. Now, what probably threw you off is the double shift. Either way, they can take this patient. Okay, so number 14. The nurse is caring for a patient with rheumatoid arthritis who is taking naproxen twice a day to reduce inflammation and joint pain. Which symptom is most important to communicate to the healthcare provider? 1, joint pain worse in the morning. 2, dry eyes bilaterally. 3, round and movable nodules under the skin. Or 4, dark colored stools. Now it's going to be number 4. The reason why is because we do know naproxen, that is an NSAID, and NSAIDs can actually cause GI bleeds, and dark colored stools, that can be a sign of your like a adverse effect of the NSAIDs. The other ones, the other 3, those are going to be your expected findings for rheumatoid arthritis. They can have dry eyes bilaterally, that is your Sjögren syndrome. They can have nodules under the skin, those rheumatoid nodules, and then they can also have joint pain that's worse in the morning. This pain usually lasts for about 60 minutes to even several hours after waking up. So that would be an expected finding. So let's do 15. Which of these patients cared for by the nurse in the clinic presents, I'm having a hard time today. Which of these patients cared for by the nurse in the clinic presents the highest risk for infection with human immunodeficiency virus during sexual intercourse? 1. Uninfected man who reports performing oral intercourse with an HIV infected woman. 2. Uninfected man who's the receiver during anal intercourse with an HIV infected man. 3. Uninfected woman who has vaginal intercourse with an HIV infected man. Or 4. An uninfected woman who has performed oral intercourse with an HIV infected woman. So the highest risk is actually going to be number 2, uninfected man who is the receiver for anal intercourse with an HIV infected man. Now, the other options, yes, they definitely can cause a spread or infection of HIV, but the highest risk is going to be that male to male anal sex. The reason why is because anytime you do have any type of intercourse, it doesn't matter where it's at, it's going to cause these little micro tears that happen, and those micro tears open up, and that does make an opportunity for the infected semen to get into the bloodstream and then infect the patient. And we do see this happen at a higher rate and a higher risk in male anal intercourse. Again, the other ones, they can definitely cause an infection or transfer the virus to the next person, but the highest risk is going to be number 2. Now, 16. A patient with a history of liver transplantation is receiving cyclosporine, prednisone, mycophenolate. Which finding is most concern? So 1, gums appear very pink and swollen. 2, blood glucose level is 162. 3, non-tender lump above the clavicle. Or 4, grade 1 plus, oh my goodness, I can't speak today. Grade 1 plus pitting edema in the feet and the ankles. Now, the most important one, that is going to be number 3. It is those non-tender lumps above the clavicle. Now, the reason why number 3 is by far the most important one, that is because a non-tender lump above the clavicle, that can be a sign of cancer, especially in the lymph node. So that's going to be something we're going to be very, very concerned about for patients who have a liver transplant and are receiving these anti-rejection medications. The other ones, those could be expected findings as far as the medication management that is going on with the patient. Okay, now let's go on to 17. A patient with human immunodeficiency virus, HIV, who has been started on antiretroviral therapy is seen in the clinic for a follow-up. Which test will be best to monitor when determining the response to therapy? 1, CD4 level. 2, complete blood count. 3, total lymphocyte percentage. Or 4, the viral load. The correct answer is going to be 4, the viral load. So the reason why that is going to be very important is because, look, they're giving you antiretroviral therapy. So what are we going to be looking at? The viral load. And so we would then look at the CD4 level to see the progression of the HIV disease and how immunosuppressed they are. But the whole purpose of having antiretroviral therapy is to decrease the viral load. That's the whole purpose of this medication. So in order to assess and evaluate the efficacy of this medication, we're going to be looking at the viral load. That's the whole job of this medication. So 18. A hospitalized patient with acquired immunodeficiency syndrome has wasting syndrome. Which nursing action is appropriate to assign to an LPN/LVN who is providing care to this patient? 1. Administering oxandrolone 5 milligrams daily. Assessing the patient for other nutritional risk factors. 3. Developing a plan of care to improve the patient's appetite. Or 4. Providing instructions about a high-calorie, high-protein diet. The most appropriate one that is going to be within the patient's scope of practice is number 1. We can give, LPNs can give medication, oral medications to patients, especially if they're stable. Assessing that completely tosses out that option. Developing a plan of care. That phrase tosses that option out. LPNs do not develop plan of cares. This is going to be with the RN, that's our scope of practice, and it's also the dietitian's scope of practice as well. Providing instructions about a high-calorie diet, that providing instructions, that is another term for teaching. They do not teach, they do not educate patients. They can reinforce already taught information. So number 4, this would be like you're giving them the information brand new. It's not reinforcing. If it was reinforcing information, the answer option would have said reinforce or re-educate, something like that. 19. The nurse assesses a 24-year-old patient with rheumatoid arthritis who is considering methotrexate for treatment. Which patient information is most important to communicate to the healthcare provider? 1. The patient has many concerns about the safety of the drug. 2. The patient has been trying to get pregnant. 3. The patient takes a daily multivitamin tablet. 4. The patient says that she has taken methotrexate in the past. So the most important one, that's going to be number 2. The reason why is because methotrexate can actually cause spontaneous abortions. Methotrexate can also be used to induce an abortion as well. So if they are trying to get pregnant, this is an inappropriate medication to get them started on. Even prior to ever starting a patient on methotrexate, regardless if they are trying to have a baby, if they are still menstruating, we are going to first rule out pregnancy because ethically we cannot give this medication. Now, a daily multivitamin, that's not so bad. Now, methotrexate, it does, I don't want to say inhibits, but it inactivates folic acid. And I would give this to my medications, very very high dose, given that for cancer, and we would actually give them folic acid like later on in the day to basically rescue the body so that it doesn't completely deactivate their folic acid. You need folic acid, and so we would give it to them. Like I think I want to say like maybe 6-8 hours after the administration, we'd give them IV folic acid to rescue and have that folic acid reactivated. But the other options, they're not necessarily things that are going to make us really question whether or not the patient should be on methotrexate. However, trying to get pregnant, yeah, we can't do that. So 20. An 18-year-old college student with an exacerbation of systemic lupus erythematosus has been receiving prednisone 20 milligrams a day for 4 days. Which action described by the healthcare provider is most important for the nurse to question? So we're looking for an inappropriate response or an inappropriate order. Discontinue prednisone after today's dose. 2. Give a catch-up dose of varicella vaccine. 3. Check the patient's C-reactive protein level. Or 4. Administer ibuprofen 800 milligrams POTID, that is 3 times a day. The most correct answer is going to be number 2. It's giving that dose of varicella vaccine. The reason why is because as we are giving them prednisone, it does decrease your immune system, your immune response. The last thing we want to do is to give a vaccine, especially a live vaccine. Now, SLE patients, it is an autoimmune disease. When they have a flare, last thing we want to do is to ever give them a live vaccine anyways, because it's going to make them sick. So that's not going to be a good idea. So that is why number 2 is going to be the best answer. And that is going to be the best order to question. Alrighty. So 21. A patient with wheezing and coughing caused by allergic reaction is admitted to the emergency department. Which medication will the nurse anticipate administering first? 1. Methylprednisolone 100 milligrams IV, cromolyn 20 milligrams via nebulizer. 3. Albuterol 2.5 milligrams per 3 mLs via nebulizer. Or 4, aminophylline 500 milligrams IV. The appropriate one is going to be number 3, and that is that albuterol. So the reason why albuterol is the best option is because that nebulizer, that is going to hit the patient fast. That is a rescue inhaler. And look at their signs and symptoms. It is wheezing and coughing caused by an allergic reaction. Now, if epinephrine was on this option list of options, that would be the best one, but that's not on here. So then we go to the next one, which is albuterol. Anything that is going to be an oral med, we can toss out. Your cromolyn, that is going to be a preventative for your your asthmatic patients. So that's not going to be a good option for these patients. Okay, let's move on to number 2. So number 2, a patient with systemic lupus erythematosus is admitted to the hospital with acute joint inflammation. Which information obtained by the laboratory testing will be the highest concern to the nurse report to the which laboratory testing will be of highest concern to the nurse? Number 1, elevated BUN, increased C-reactive protein. Oops, let's bring this down for you guys. Positive anti-nuclear antibody test result, or 4, positive lupus erythematosus cell preparation. The most appropriate answer, that is going to be that elevated BUN. We do know that lupus, it can affect any body system, but particularly it can affect the kidneys, and we need the kidneys. They need to stay safe and healthy. If the BUN is creatinine, that's a sign that they're working a little hard, right? We would expect to see a high C-reactive protein level. That is a very vague lab draw that we can draw that tests for inflammation of the body. That is going to be an expected finding with lupus, especially if they're in a flare. Patients with lupus, they can definitely have an ANA, an anti-nuclear antibody that is positive, because this is an autoimmune disease as well. So that's why number 1 is going to be the most appropriate option. 23, the nurse obtains this information when assessing a patient with human immunodeficiency virus who is taking antiretroviral therapy. Which finding is most important to report to the healthcare provider? 1, blood glucose level is 144. 2, the hemoglobin is 10.9. 3, the patient reports frequent nausea. Or 4, the patient's viral load has increased. The correct answer, that is going to be number 4. We do know that the viral load, as it increases, this just means that the disease is progressing. especially if the patient is on antiretroviral medication and that viral load is still increasing. This can be a sign that either the medications are no longer working, maybe the patient isn't taking it appropriately, they're skipping doses, or maybe they're not taking their medications at all. But this is something that we really, really need to get a hold of. Number 24, initiation of a subcutaneous, oh geez, etanercept for a patient with rheumatoid arthritis is being considered. Which patient information is most important for the nurse to communicate with the healthcare provider? 1. The patient is currently taking methotrexate. 2. The patient has a positive tuberculin skin test result. 3. The patient has had type 2 diabetes for 5 years. 4. The patient is anxious about having to self-inject. The appropriate answer is going to be number 2. The reason why is because we don't want to give this medication to a patient who not only do they have a flare of this autoimmune disease, but they also have TB. We need to treat the TB. Also, what is this medication? This is actually a medication that is used for rheumatoid arthritic patients to slightly hush their immune system so that they don't have flares. But this can actually cause a reactivation of TB if the patient was previously infected with tuberculosis. So we would not want to continue, or we would hold off taking this medication. We want to make sure that we rule out an active infection. And how do we do that? With a chest x-ray. And then if they are positive, we are going to we're going to treat that TB. So 25. The hospital employee health nurse is completing a health history for a newly hired staff member. Which information given by the new employee most indicates the need for further nursing action before the new employee begins orientation to patient care? 1. Employee takes enalapril for hypertension. 2. Employee has allergies to bananas, avocados, and papayas. 3. The employee received tetanus vaccination 3 years ago. 4. The employee's tuberculin skin test has 5 millimeters in duration at 48 hours. The correct answer, that is going to be number 2. So the reason why this is the priority is because we have evidence that shows patients who do have these allergies, banana, avocados, and papayas, they tend to have latex allergies. So what we want to do for this employee is have them do further testing to rule out latex allergies because there can be quite a bit of latex in some of our medical supplies. So 26. A patient who has human immunodeficiency virus and is taking nucleoside reverse transcriptase inhibitors and a protease inhibitor is admitted to the psychiatric unit with panic attack. Which information about the patient is most important to discuss with the healthcare provider? 1. The patient exclaims, "I'm afraid I'm going to die right here." 2. The prescribed patient medications include midazolam, 2 milligrams IV immediately. 3. The patient is diaphoretic and tremulous and reports dizziness. 4. The symptoms occur suddenly while a patient was driving to work. The correct answer, that is going to be number 2. That is going to be the midazolam 2 milligrams IV. Now, the reason why it is number 2 is because with these medications that the patient is taking, this can decrease the metabolism of certain medications, especially benzos. So if you have a slow metabolism of any medication, we can accidentally overdose you, and especially like unintentionally, of course, but it's going to make you have more drug levels in your body than you actually need to have. So we would not want to give this medication to the patient. 27. A patient seen in the sexually transmitted disease clinic has just tested positive for human immunodeficiency with a rapid HIV test. Which action will the nurse take? Which action will the nurse take next? 1. Ask about patient risk factors for HIV infection. 2. Send a blood specimen for Western blot testing. 3. Provide information about antiretroviral therapy. Or 4. Discuss the positive test results with the patient. It's going to be number 4. Discuss the positive test results with the patient. We're going to do that prior to starting antiretroviral treatment. The reason why is because there's quite a bit of planning that goes into that, and you need to make sure that the patient is actually ready and willing to actually follow through with these medications. We wouldn't necessarily do the Western blot test at that time. We would definitely want to let the patient know so that they know what's going on. They deserve to know what their diagnosis is. So then we get to 28. It's a little bit of a different type of question, so this is kind of nice. So this is a clause, right? This is kind of what you may see on the NCLEX, right? That next gen question. So scenario, a patient with a history of heart failure and rheumatoid arthritis is on a daily dose of prednisone 5 milligrams to decrease, and then option 1, swelling, immunity, heart failure, or inflammation. The correct answer is inflammation. Prednisone decreases inflammation. And bone erosion, heart rate, synovial fluid, or joint movement. It's going to be bone erosion. And this is going to be why we give prednisone to rheumatoid arthritis patients, so that we are decreasing the inflammation and we're preventing that inflammation from eating away at that bone. We want to preserve the bone. So the healthcare provider has increased a daily dose of prednisone to 20 milligrams every day and added a non-steroidal anti-inflammatory to be taken every day with meals for increased pain relief. The next day, the patient reports swollen legs and feet. Based on the patient's history and reports of swollen legs and feet, what nursing intervention should be initiated? So we go to number 3. Administer furosemide, daily weights, increase trans fat in diet, or limit fluids. Daily weight, we can do that. We don't need a doctor order to do daily weights. We do need a doctor order to do furosemide, and we need an order for limiting fluids as well. Increasing trans fat in the diet, that is going to make their heart failure worse. And that is what we're worried about, right? They have swelling in the legs and feet. We're worried that that might be worsening of heart failure, but we're going to monitor their daily weights to kind of get a nice look of how much fluid are they actually retaining. A patient diagnosed with systemic erythematic lupus, it's kind of flipped over, but whatever, is being seen in the clinic for a follow-up appointment. She is prescribed cyclosporin and indomethacin. Which statement made by the patient should the nurse assess first? 1. My feet are swollen. 2. I have a paper cut on my index finger and it is red and painful. 3. It seems like I'm always so tired. 4. I am using vitamin C cream to minimize the rash on my face. The correct answer, that is going to be number 2. So even though it is a small paper cut, that can still be the perfect opportunity for an infection to enter the body. And remember, SLE, that is an autoimmune disease. They are more susceptible to getting sick. They can have what's called Felty syndrome, which is decreased white blood cell count and an increased size of their spleen. That is going to make them even more at a risk for infection. So that little paper cut, that can actually make the patient go septic, and that's something that we're going to want to keep a very close eye on. Okay, so let's do some drag and drop questions. So instructions indicate which staff member listed on the second and third columns are most appropriate to be assigned to the patient scenario listed in the first column. Number 1, perform assessment on the patient with dementia. That is going to be the RN. Key term, that is assessment. Administer, ribavirin and I don't even know, by way of intramuscular injection to a patient in a phase 3 trial. That can actually be an LPN. 3, collect sterile urine specimen using a urinary catheter. That can be an LPN. Provide discharge teaching to a patient waiting for discharge. That's an RN. That provide discharge teaching, that's education, that is an RN's job. Flushing a peripherally inserted central line with normal saline, that is the RN. LPNs cannot touch central lines. That is a PICC line. That is what PICC line stands for, PIC. That is going to be a peripherally inserted central line catheter. 6, assisting the healthcare provider with debridement of a third-degree wound. LPNs can actually do that. They can assist. Obtain a routine 12-lead EKG or ECG on a new admission. That is the RN. Anything new admission, new diagnosis, the patient is going to go to an RN. All right, we're almost done. So, this one right here, we have a scenario. The nurse is caring for a patient with a diagnosis of human immunodeficiency virus, HIV. He reports that he is currently using injectable heroin and methamphetamine. His vitals, his temperature is 99 degrees Fahrenheit. Blood pressure is 100/90. Pulse is 100. Respers are 24 breaths per minute. His labs, his CD4 levels is 600. His white blood cell count is 900 with a viral load of 30,000. Medication, he has Bictegravir. Oh my gosh, that's not how you say it. Bictegravir. Oh my gosh, I suck at saying medications. Amtricitabine and tenofovir, 25 milligrams. So those are the medications that he is on. So we're going to be looking at these orders, and then what we need to decide is it indicated? Is it contraindicated? Is it non-essential? So 31, referral to substance treatment program. That is indicated because he does admit to using meth and heroin. 2, enroll the patient in a needle exchange program. Yes, because even though he is HIV positive, he is still using heroin and meth, which can be injected meds. 3, directly observe antiretroviral treatment. Yes, that is absolutely indicated. They need to be on antiretroviral medications, and we need to make sure that the patient is actually taking these medications. 4, chest x-ray. Non-essential. I mean, we might want to do it if we want to see if there is some type of infection, but really we don't need it. 5, Prescription for rifampin, 300 milligrams orally twice a day. That is contraindicated. We don't need to be giving this patient this medication. This is a TB medication. 6. Prescription for buprenorphine or naloxone. Oh my gosh, I can say this, naloxone. 6, that is going to be indicated. 7, transthoracic echocardiogram. Yep, that is indicated. Now, the reason why is because these medications, that can wreak havoc on your cardiovascular system. So it can cause myopathy, which is an enlarged heart. It can cause it can cause a whole lot of issues with your valves, the functionality of the heart. So that echo can definitely help us diagnose if there's anything wrong with the cardiovascular system, particularly the heart itself. So there you go, guys. That is how you want to utilize this textbook, and that's how you want to be taking your priority questions, your delegation questions. I will be doing more of these, of course, throughout several weeks. I also started a podcast called Rosie the Riveting RN that is on any major podcast platform. You can start listening to some today. There's a couple episodes up there. I also have a YouTube channel, Rosie the Riveting RN, on how to read the textbook because that can be pretty intimidating. And I used to be someone who would just highlight everything and think that you have to memorize the entire book, but you really don't. You need to know how to interpret the information and how to utilize it. That's the biggest thing. So I hope this helped you guys today. Please like, join, subscribe. I hope you have a wonderful day. And remember, the best medication is patient education.